I chose to participate in the ImpacT-RNS clinical experience originally for the fact that one day I hope to return back to the rural and agricultural healthcare setting. That was definitely my intention going in. However, I quickly learned that the experience was going to be much more than that. I was able to kind of see that role of the continuum of care in the rural settings. So one thing that immediately stands out to me when reflecting back on my IMPACT experience was definitely learning about that continuum of care that you receive after the hospital. As students in our clinical program, like right now, you really see that hospital experience and what happens admit to discharge. We don't really learn about, okay, after discharge, what happens? We're sending our patients home, and what happens to their health after that? How do they continue to stay healthy so that they don't come back to the hospital? And so the IMPACT program really taught me that chronic disease management, that case management, that interprofessional care that all goes into helping patients stay healthy so they don't go back into the hospital. So I would say one of the main advantages of the IMPACT program that was different for me as an individual from rather than the whole clinical program or even the other girls going through the IMPACT program was just the individuality of it. We definitely don't, as students right now in the standard clinical program, like I said, see that continuum of care. We don't really see the clinic side. I mean, there's a high percentages of nurses that go back into primary care rather than straight into the hospital, which is definitely what we're trained for. Throughout the whole experience, I saw just a wide variety of the interprofessional team. I was with the RN care manager, I was with the diabetes educator, I was with cardiac rehab nurse, and then I also spent time in the clinic with those LPNs, with those providers, those NPs and PAs, also with those RNs that are in the clinic. And so being able to see really everyone's side of things helped me recognize how much work goes into each patient to make sure that their healthcare and that their health is staying up to date. So I would definitely say the individuality of being able to see all these different perspectives come together to take care of one patient. The advice I'd give to students, no matter whether you're interested in rural healthcare or not, is to go for it. A lot of these people that are working part of the team in the primary healthcare setting are also working in the acute setting, are working on the hospital sides of things. So I had a little bit more of an appreciation of providers, case management, and then just kind of seeing where they're coming from and what their goals are for each of the patients can help me as a nurse. Time and time again, I ran into nurses or other professionals that said, oh my goodness, this program is amazing. I wish I would have been exposed to primary care during my schooling, because a lot of times as nursing students we aren't. The biggest skill that I learned in the ImpactRNS program had to do with communication and personal development. As nursing students, when we hear skill, we automatically think of IV starts or a Foley catheter or changing a central line dressing or something like that, something that we can automatically do with our hands, get in there, hands-on. The ImpactRNS program really taught me the importance of communication with the interprofessional team and also with your patients. In Canby, we were, as a RN care manager, we really focused on the social determinants of health that we learn about in school. What are they needing in terms of, like, are they able to get adequate housing and electricity? Are you able to get food? Are you able to have the financial means to and transportation needs to get to your appointments? Because sometimes we just expect everyone to come. Like, you need this in your healthcare. Why aren't you showing up? Why aren't you here? So as RN care manager, we were able to further dive into those maybe harder and a little bit touchier subjects of social determinants of health that could impact whether patients are coming back for their follow-up appointments, or why are they not coming back and then showing up in the ER 2 weeks later.